Frontier Direct Care is direct primary care, direct contracting, and direct RX. Now, with direct primary care with Frontier, the employees and their family members have access to a primary care physician at zero out-of-pocket cost, where the employer is essentially paying a subscription for access to that primary care physician. Now, that primary care physician has an office clinic that's nearby to them, and they can have same-day and next-day appointments, but then they can also have virtual care from that same doctor as well. So whether it's 9 p.m. on a Friday night, or if it's the 4th of July, they have 24/7 access to their doctor. Now, that doctor is going to be able to assist them with pediatric visits as well for the kids, for well women visits, for sick visits, for like a cough, or also for chronic conditions like diabetes, even for injuries like a sprained ankle or for lacerations as well. Now, we know at Frontier that the direct primary care clinic, they can't take care of every need. People are still going to need specialist physicians. So that's where the direct contracting comes in. So Frontier sets up direct contracts with specialists for various tests and procedures. So it might be like an endoscopy from a gastroenterologist, or a stress test from a cardiologist, or even elective surgery with an orthopedic surgeon, where Frontier will actually pre-negotiate a specific dollar amount. Again, it's paid for by the employer, but when the employee or their family member goes to see that specialist, again, it's at zero out-of-pocket cost for them to have that specialist care, and the employer ends up paying a lot less, even less than in-network rate with their traditional insurance carrier or network. And then finally, with Direct RX, the patients at Frontier actually have access to a free mail order pharmacy for generic medications. And it's a formulary of over 1,000 generic medications, where when the Frontier doctor prescribes the medication, it literally shows up at the employee's home within several days. And they don't even have to think about getting their refills filled, because again, it'll automatically come to them, which is incredibly helpful for adherence and compliance with medications, because the medications only work if people actually take them. So when you combine the direct primary care with the direct contracting with the direct RX, you end up getting much healthier employees that have dramatically lower use of the healthcare system. You have lower ER visits, you have lower hospitalizations, which ends up translating into lower overall healthcare costs. Thank you for watching.